currently practicing just outside of Atlanta, Georgia, and I am a regional resident liaison for Region 7 as a volunteer for NCOPE. And today I will be talking about which residency is right for me. So what we will be discussing today are the types of facilities that you can do your residency at, the different residency tracks, and the timeline to complete your residency. It is important to note here that I did both of my residencies at hospital institutions. I did my orthotics residency at Children's Healthcare of Atlanta and my prosthetics residency at the Rehabilitation Institute of Chicago, now known as the Shirley Ryan Ability Lab. So I may have some slight biases towards hospital residencies, so just wanted to put that out there for everybody. So a few things that I think it's really important to discuss across the board is when you are looking for a residency site, you want to make sure that it is an NCOPE accredited residency site so that you check all your boxes when you are applying for your ABC board exams. So the other thing that I kind of just wanted to touch base about is that all of the residency sites are going to vary. Their structure is going to be different. The teaching styles of the clinicians are going to be different. Your levels of independence are going to vary, and job opportunities at the conclusion of your residency are going to be different. A lot of sites will have, sometimes you have multiple offices you have to go to, sometimes you follow multiple practitioners. Your level of independence, it will vary depending on what you are reaching as a resident. So I think these are just really important things to consider as you start down this residency search and path. So there are kind of two types of facilities: hospitals or institutions, and then private practice. I'm including the VA in the hospital institution because I think that's the umbrella that they fall under. So I think there are a few things to note between the two different types of facilities. Both have positives, both have negatives. Again, I think this is all going to be dependent on you and your personality and what you're getting or hoping to get from a residency site. I think in my experience, hospitals and private practice, they both have multiple locations. Are you going to need to travel to these locations throughout the week, throughout the day, throughout the course of the year of your residency? Do you have the means to travel? Do they provide transportation? Is there public transportation that you can use? These are things that you will want to consider. In my experience, a hospital or an institution-based facility provides, I think, a greater access to a variety of patients. I think you're likely going to see some higher level devices that you may not see at a smaller practice throughout the United States. For example, the Shirley Ryan Ability Lab is an extremely renowned facility, and they've got people flying in from all over the world to receive treatment there. So I think you have an opportunity to likely see the more variety of presentations, case presentations. I think hospitals lead easier for multidisciplinary approaches. When you are in a hospital or an institution setting, you have access to physical therapy notes or physician notes. So when you're doing an acute rotation and you're trying to decide what's due for a patient and you go do your initial eval, you decide to wait a few days, you can kind of monitor the patient's progress just by reviewing the chart and leaning on the whole treating team. I think you could potentially even just pop in on a physical therapy session when you're located in the same building. It just makes that type of thing a little bit easier to do. Oftentimes, though, I think people refer to working at a hospital as working in la la land. It's very easy to just provide what you think the patient needs And of course, you still need to follow Medicare guidelines, but because hospitals have cash flow from other aspects of the hospital and it's not solely dependent on the orthotic and prosthetic patients that walk in, I think it's easier to not be as familiar with some of the Medicare guidelines, some of the restrictions for insurance companies, and I think even like cost analysis between different supplies, like looking up the cost of goods, liners, for example. You can have two different seal-in liners, and one manufacturer is going to be significantly cheaper than the other. And I think you just need to pay a little bit more attention to that when you're in private practice, because there's not other ways to make money. Hospitals also follow, they have joint commission standards. So not only will the orthotic and prosthetics department need to follow the ABC standards, but then the hospital as a whole has to follow this joint commission, which is some very strict rules and regulations. So I think hospitals can be more regimented in some of their policies and procedures that may not be the case in a private practice. Hospitals also tend to have hospital charting systems like Epic or Cerner, and those are geared towards the whole realm of healthcare, anything from nutrition to ER to blood work. So sometimes navigating O&P charting and what you're doing for your patient can be a little challenging because it's not conducive to what we do. Or, orthotics and prosthetics is a really small niche. And so trying to use some of these other charting systems do present with different challenges. Now in private practice, I'm including Hanger in private practice. So you can have big or small private practices. I think there are probably more residency positions within private practice. I think when you're trying to get a residency with a private practice, their needs are going to come and go depending on how business is going. Where at a hospital, they probably have it pretty consistently budgeted for a resident each year. So I think there might be a little bit more flow of, yes, we are taking a resident, no, we're not taking a resident in private practice. I think one of the really unique things that private practices can offer to residents is a marketing experience. Like I said a second ago, hospitals they're known in the cities that they are. They've got reputations, people know about them. They've got probably an entire marketing department that, small little orthotists and prosthetists don't necessarily need to go out in the market. They've got a direct referral source with the doctors being embedded into the hospital. But in private practice, you have to draw up your business. So I think it's a really unique opportunity for residents to experience going in and providing in-services and introducing yourself to various physician groups and therapy groups in your city to try to build those relationships for improved multidisciplinary care. You still have multidisciplinary care in private practice. It's just not right there at the tip of your fingers, in my experience. Private practice follows ABC guidelines. So you need to provide ethical and optimal patient care through the ABC standards, but you don't have the rigidity of joint commission. With private practice, Hanger is so big that they are able to create their own Hanger Ed Fair, and I cannot speak to whether or not you as a resident would have the opportunity to go to the Hanger Ed Fair. That would be something you would need to discuss with them, but they are able to provide those continuing education opportunities for their employees, which is really, really great. O&P charting tends to be used in private practice, like OPI. OPI is a great resource for O&P clinicians because it just follows your typical treatment plan. It was developed by practitioners, so it just has everything you need right in there for you to make sure you're documenting everything that you need. So again, there's good and bad to both types of facilities. You just have to think about what works for you. So do you choose a clinical track or a research track? I think it's important to note that when you choose the research track, it does not mean that you are only doing research the whole time. You are still involved in direct patient care. You just have to do a directed study program. Whereas clinical, you do journal clubs and case presentations. You have those requirements between the two tracks. And I think it's important to think about what it is that you want. Are you wanting to just focus on clinical care? Are you interested in research? Does the site offer support to do some research studies? Those are the things that you'll want to ask the residency sites if you are interested in those opportunities, and how can they support you. There's also the 12-month or 18-month tracks now. I think for your first discipline specifically, if you do a 12-month track, you are fully invested in that discipline. And I think that is very beneficial for you to have a sole focus. But at the same time, I think if you're doing the 18 months, you are focusing on two disciplines. The patient care, how you talk to your patients, carries over between the two disciplines, and you do complete your residencies in a quicker time frame. I think the thing to really consider there is back-to-back board exams. Are you a person who can take back-to-back board exams? If you're not, then you're going to have to wait a few months after completing your residency. And are you going to forget or decrease your momentum on what you've learned throughout your residency by taking a break between the two exams? So again, just things to consider between the different options that you can do when you are picking a residency. So some other things that I think are really important to consider, and somebody told me this when I was a student, and I think it's important to share with everybody, is as much as the residency site is interviewing you, I think you need to interview them. You want to make sure that your learning styles jive with their teaching styles, because it is ultimately a learning experience for you. This is a way for you to continue and develop as a practitioner, and you want to make sure that you place yourself in the best opportunity for you to be successful. Other things, fabrication. Are you expected to do some fabrication? How much? Is the lab on-site, off-site? Will they let you block time in your schedule to get off-site or to do the fabrication? Talk to them about patient population. What are the diagnoses you see? What are the ages you see? What are the activity levels? What are the amputation levels? What are the orthoses levels? Are you doing a lot of spine, KFOs, AFOs, arch supports, diabetic insoles? Asking all those questions. And I think multidisciplinary care is so crucial to patient success that it's important to see what the facilities have in terms of access to physicians and therapists and case managers. Are there physicians and therapists willing to discuss and brainstorm when something challenging comes up? And then lastly, I think something that's also really important to discuss is on call. Are you going to be required to be on call? Is that okay with you? I don't think it's necessarily bad for a resident to be on call, but that's ultimately something that you need to decide if that is or is not important for you. So I hope you got some good information out of this. Again, my name is Teresa. My email is tfield@ncope.org. If you have any questions, please don't hesitate to reach out. Thank you so much and have a great day.